Good morning. My name is Brittany, and I'm the program manager for Alabama Lifespan Respite. Today, we're going to talk about pandemic-induced anxiety. So, as you guys know, we are deep in COVID-19, and we have gotten a lot of feedback from our caregivers on the feeling of anxiety, not wanting to leave the house, not being able to figure out what it is. So I thought that this was very appropriate to talk about. So we're going to get started. And today, before we get into the other slides, I'm going to go over these objectives, but I don't want you guys to be very overwhelmed by the amount of words that are on these slides. Typically, I don't do this. Typically, what I do is shorten it a lot more if I'm in person doing these workshops, but because we are virtual, I wanted all of the information to be on the screen. In case you miss something, you guys can kind of go back and review that. So again, don't be overwhelmed. I'm going to go through everything for you. I just wanted you guys to have access to the information, my resources and things like that. So, objectives. We're going to define pandemic. We're going to talk about anxiety, and we're going to discuss the DSM-5 criteria. And we're going to talk about the difference between anxiety and an anxiety disorder. There is a difference, so I want you guys to be aware of what that is. We're going to review the cycle of anxiety. On this particular slide, I'm going to kind of walk you through the cycle, but if you'll go later after the workshop is over and copy and paste the link that's on that slide for you, it'll actually talk you through it. There's a licensed professional counselor who discusses like the stages, the cycle of anxiety in depth. And it's not very long. I think it's 5-minute video. So I highly recommend doing that. We are going to discuss the populations that are at higher risk for this anxiety that everybody is dealing with right now. We're going to talk about some common reactions that are seen. We're also going to talk about some of the effects that are seen by those folks who are like ending home isolation. They're not quarantining anymore, or those folks that are just recovering from COVID-19. I'm going to give you guys some of the top 10 COVID-19 anxiety reduction strategies. So you guys have those in your pocket in case you start experiencing some of this, if you're not experiencing some of this already. And then I'm also going to give you some healthy ways to cope. The healthy ways to cope and the reduction strategies kind of go hand in hand. I just wanted you guys to have as many solutions to this as possible going forward, right? The more educated you are on the topic, the better able you are to deal with things like this. And I'm not sure at what point in time we are going to see this COVID-19 go away. So it will definitely be handy to be able to kind of review back or refer back to this presentation at any time. All right. So the first things first, what is a pandemic? So a pandemic is an outbreak of a disease that occurs over a wide geographic area, and it affects exceptionally high proportion of the population, okay? So this is not something that happens just in Alabama or just in the north part of the state. This affects the entire world, right? So some of those examples, of course, Spanish flu, Black Death, Black Plague, that's interchangeable. And then, of course, the most familiar we probably are right now is with COVID-19. All right, so anxiety. Let's talk about anxiety for a little bit. What is it? And if you see this little graphic that I have on the slide with a bunch of different like scribbles, that's almost how I like to describe or give a visual for what anxiety is. You don't know which way you're going, what's coming, what's going. It's just a big old mess. intertwined in there, and you can't figure anything out, you can't sort anything out. Some of the simple things that we run into or that we would normally think are simple become very convoluted and difficult for us to understand or to come up with solutions. So the definition of anxiety is an abnormal and overwhelming sense of apprehension and fear, often marked by physical signs. So these can be tension, sweating, increased pulse rate, there are many more. By doubt concerning the reality and nature of the threat, and by self-doubt about one's capacity to cope with it. Okay, so I'm going to move on to the second bullet. Again, these are all different definitions of anxiety. So apprehensive uneasiness or nervousness, usually over an impending or anticipated illness. And then you've got a strong desire, sometimes mixed with doubt, fear, or uneasiness, right? So if you're like me right now, it makes me pretty anxious to go into stores, to go shopping, to do some of the things that we normally do because there are so many unknowns with COVID-19. So again, being as prepared as we can be, going in, washing our hands like we're supposed to, wearing our mask, practicing social distancing, staying 6 feet apart, all of those things will be beneficial to our health. Not only, help us prevent getting COVID-19, but it also will help the anxiety portion, the mental health of you guys. All right, so I told you we were going to talk about the criteria to diagnose anxiety. So right here, this is how you get diagnosis if you're not familiar with that. Diagnoses such as anxiety, major depression, things like that. Those all come from diagnostic criteria in the DSM-5. So with an anxiety disorder, right, there has got to be excessive anxiety or worry. This has to occur more days than not for at least 6 months, okay? Multiple different areas. It's difficult to control. Anxiety and worry are usually associated with some of the following, at least 3, okay? So restlessness or feeling keyed up or on edge, being easily fatigued, anxiety will drain you, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance. So those are the things, and it's got to be 3, okay? 3 of those or more that occur over a 6-month period, and it also has to encompass multiple different topics, okay? And not easy to control. So I've got this graphic on here for you guys to kind of see what the difference is. What I really want you guys to focus on under anxiety, I want you guys to notice that first one, a normal reaction to stress or difficult times. Everybody experiences anxiety to a certain level at some point in time, usually triggered by something specific, right? So a big life transition might happen. So maybe you're moving to a different state, or maybe somebody in the household due to COVID has lost a job, and that's financial stress. But anxiety has a beginning and an ending point, okay? So, and they say some stress, right? So stress is what causes the anxiety. They say that some stress is good stress, right? Sometimes we procrastinate and we need that extra push or stress to get us through what we need to complete. As far as the anxiety disorder, this is ongoing. It can last weeks, months. It interferes with our day-to-day life. Most of the time it feels impossible to control or manage, okay? So that's the anxiety disorder. So I want you guys to go back and kind of go through all of these different topics that they have under anxiety and then anxiety disorder to help build a clearer picture of the difference. You see, again, anxiety is just a normal reaction due to a specific stressor, right? And then your anxiety disorders, that's when that comes in. And you can go back to the slide before and kind of go over that DSM-5 criteria. But that's where it really talks about the anxiety disorder. Generalized anxiety disorder is typically what it is. All right, guys, so this is the cycle of anxiety. I told you in the beginning, I was going to kind of walk you through how it works, which is very interesting if you haven't given much thought to it or done much research on it. But I did provide that link. So if you guys just copy and paste that bullet that you see under this graphic and put it in your browser search engine, you can pull up that video. And again, it's of a licensed professional counselor, and it kind of talks you through it. So I'm going to give you a very, very short version of that. So you've got your anxiety. So whatever it is, if it's COVID-19 that has caused this anxiety, we stay at home, right? So that's when you go into that avoidance period. And because we're avoiding, getting exposed to COVID-19, it gives us some of that short-term relief, okay? But that short-term relief, especially if we're not dealing with it, if we're avoiding what's making us very anxious, it turns into long-term anxiety growth. So it might feel good for a few minutes to avoid that and to be at home for a little while and not have to go out into the world. But eventually, when we have to go out into the world, because we've avoided it so much, that anxiety has grown and grown and grown, which makes it worse, okay? So that's why they talk a lot about, when you're talking mental health and counseling and things like that, if you're anxious over something, if you've got a fear, a phobia, something like that, the more you deal with it, the more you process whatever that fear or phobia is, your brain starts to react a little bit differently, and it feels like it's okay. So when you're dealing with things, it teaches your brain that, okay, this is not going to hurt me. This is not going, this doesn't mean that I'm going to get COVID-19 if I do this, right? But if you avoid that, your anxiety gets worse and worse, and it starts building and building. So when you go out and you try to go into the world, it becomes essentially a disaster, right? So again, we want to try to handle those things that are making us super anxious in the beginning instead of letting it build up, because you'll just keep going straight through those cycles, okay? All right, so let's talk about some populations at risk. This is probably nothing that you haven't heard before. And again, I want to remind you guys, don't be overwhelmed by the screen. If you don't want to look at the screen at all right now, I'm totally fine with that. I'm going to go through these. But some of the populations that are at more of a risk for pandemic-induced anxiety, right? Or catching COVID, any of those things, people who are at higher risk for severe illness, okay? So older people of any age with certain underlying medical conditions. Again, you have probably heard this talked to death on news stations and things like that. Children and teens, and again, this is populations that are at a higher risk for that anxiety caused by pandemic, caused by COVID-19, things that are happening, right? Children and teens don't know how to handle it. They feed off of who they see. So remember that if you're around a lot of children and teens, make sure that if they're getting any information on this, that it's accurate, that it's not something that you saw on Facebook or an unreliable source. People caring for family members or loved ones. So I'm talking about you, caregivers. You're already worried about a million other things besides adding COVID into the mix. So that can make your anxiety worse. You've got doctor's appointments. You have figuring out who's going to provide some respite so you guys can take a break, the break that you need. How do you decide if somebody can come into the home or when to allow them back into the home? All of those things create anxieties to a certain level. Again, if we start recognizing these signs a little bit sooner and dealing with them at first, then those will be a little bit easier to get past versus avoiding that. Frontline workers, so healthcare providers and first responders, these people are the ones who have been essential, who have been working since the outbreak of COVID-19. They're trying to figure things out as they go, while also putting themselves and their families at risk of getting COVID-19. So this can cause anxiety with them. I already mentioned essential workers, so, I said healthcare providers and first responders, but, the food industry has also been there since day one, right? We have to eat. They've got to keep their businesses alive. So as far as, the food industry, these people have been in the throes of everything since all of this started. So again, it's that big unknown that causes this anxiety. What can we do to prevent everything? Well, we don't know all of those questions or those answers yet. People who have existing mental health conditions. So, shocker, there are a lot of people out there, like myself, who have anxiety, or they might have depression or ADHD. It could be autism, anything like that. Let me back up for a second. Not autism. Depression, anxiety, things of that nature. So if you're talking schizophrenia, bipolar disorder, that is what I mean by mental health conditions. So those people who already have these existing mental health conditions are more at risk, obviously, to have that anxiety worsen in times like this. People who use substances or have a substance use disorder, they're more at risk. Folks that have lost their job or had their work hours reduced or other major changes to their employment, right? Those all have to do with our finances and how we pay bills, how we feed our family, how we pay our rent. So all of those things, especially if you're not sure when you're going back to work, those all can be a major source of anxiety. And all, again, related back to this pandemic, right? This is why a lot of people have had their hours reduced or have lost their jobs and had to go on unemployment. People who have disabilities or developmental delays, these guys are more at risk also. So we've got people who are socially isolated from others. Rural areas, they might just be isolated in general because maybe what they do 24 hours a day, 7 days a week is caregiving for a family member. Maybe they don't have other family members or friends who can come in and help with that. So those people are going to even be more socially isolated than normal. And while some people are introverts, those folks still had the choice at one point or another to say, hey, I can be around people right now, or hey, I just want to keep to myself. Because of quarantine and COVID-19 and us having to stay in the house and social distance and all of those things, that choice has been eliminated for them to go out and have that socialization, even when they feel like they need it. It might not be as often as somebody who is extroverted, but people in some racial and ethnic minority groups, so we've heard about this also, people that are more at risk for getting this COVID-19 and then anxiety as a result of that, right? People who don't have access to information in their primary language. This can be very stressful, especially if your primary language is Spanish, right? If you don't have somebody to translate for you and you're getting bits and pieces here and there and not the full picture, that causes that anxiety, especially when we're talking about this pandemic, about COVID-19 and how we can stay safe and what we can do. So that is a huge population that is at risk also. People experiencing homelessness, right? If you don't have somewhere to go, if you don't have a home, this can be very, very stressful. And then, of course, you've got those people who live in group settings, right? Because we're supposed to be social distancing. We're not supposed to have that many people in a room at a time. So these folks who are worried about all of these things are in a group setting, which is one of the main focuses, of what we're not supposed to be doing. So again, this population could be more at risk, especially if they get COVID-19 and they pass it along to somebody else. All right, so stress-induced common reactions. Fear and worry about your own health and the health of your loved ones, of course, especially you caregivers out there who are already worried about your loved one as is, and already put all of your focus and effort on that other person. Financial situation or job or loss of support services that you rely on. So a lot of caregivers, like I've mentioned before, aren't getting respite services because they're afraid to let anybody into their home. They're afraid due to these folks possibly being exposed to COVID-19, right? Some of these people won't bounce back because of those underlying health conditions. You might notice changes in sleep or eating patterns. Difficulty sleeping or concentrating. If you have any chronic health problems, these might get worse. If you have mental health conditions that were pre-existing, these also might get worse, like I mentioned before. And there might be some increased use of tobacco and or alcohol and other substances. So sometimes people use these substances to cope. Doesn't mean that it's a healthy coping skill, but it's how they know how to cope. So these are some of the common reactions that you might see that this extra stress is bringing on. All right, so let's talk for a minute about recovering from COVID-19, or if you're ending like a quarantine period. So like, what can that look like? So you might see mixed emotions, including relief, right? It's gone, it's done. I'm going to try to live as normal as possible. Again, that fear and worry about your own health and the health of your loved ones, the folks that you're taking care of, that you're around, your family, your friends. Stress from the experience of having COVID-19 and monitoring yourself, or being monitored by others, right? See if symptoms are getting worse, if they're getting better. If I'm experiencing this, should I go to the hospital? Should I not? So you've got that struggle almost within yourself that you're dealing with. Sadness, anger, or frustration because friends or loved ones have fears of getting this disease from you, even though you're cleared to be around others. That's got to be super frustrating, super upsetting. Guilt about not being able to perform normal work or parenting duties while you had COVID-19. Mom and dad guilt are a real thing. And if you throw COVID-19 in there and you have some of the worst symptoms where you're in the hospital on a ventilator and you're leaving your kiddos at home, that's a huge guilt that we've got to learn how to figure out. Worry about getting reinfected or sick again, even though you've already had it. Other emotional or mental health changes that you might experience also. And then children may also feel upset or have other strong emotions if they or someone they know have COVID-19, even if they're better now and they're able to be around others. So now you guys have a better picture of what this can look like if somebody has had COVID-19, or if they've just been in a quarantine period. A lot of people are taking it very, very seriously, as they should, and going out very, very minimally. So again, if you guys know of somebody who has COVID-19 or has been quarantined, or if you yourself, this information is valuable to share or to have, to pass on to others. Others might not feel the same as you do, and that's okay, right? We have to let them know why we feel the way we feel. All right, so now you've got some top 10 COVID, that's supposed to be 19, not 10, anxiety reduction strategies. I apologize. So media distancing. I mentioned Facebook earlier. Facebook and social media, those are all very, very healthy, can be very healthy outlets to have to stay connected with people. So you can, not experience that social isolation. But if you're talking about COVID-19 and you already have a little anxiety going on, this could make it worse. Because there are so many articles, so many resources that are not reliable that we see on Facebook or that we see shared. And you also see a lot of opinions. It's not necessarily fact-based. So don't engage with worry. Remember the anxiety cycle that we talked about before, and please go copy and paste that link and go to that video. Focus on present odds. Do not react to physical symptoms. So if you're experiencing a cough or a scratchy throat or something like that, don't automatically go to that horrible place that this has got to be COVID-19. That is not true. We still have allergies, especially here in Alabama. So again, don't react to those physical symptoms. Focus on productivity and new ways of enjoying life. Our lives have essentially been turned upside down. We can't do any of the regular things that we were doing in the same way that we were doing them. So now we've got to be super creative and find ways to continue on with life. We can't just stop, okay? So you've got to find different things that you can do in the home. A lot of people right now are remodeling homes. Because they're stuck in the house and they're seeing all these different things that they want to fix or that they want to change. So a lot of people find that enjoyable as well. So find those new ways of enjoying life. Engage in stress reduction activities. We have done several presentations before on stress and anxiety as well, especially during the month of May, because it is Mental Health Awareness Month. So some of those stress reduction activities, do yoga. The Calm app, if you haven't heard of it, is a very, very good app to have. If it is reading a devotional every morning or every night before you go to bed. If it is drinking a strong cup of tea or having a strong cup of coffee. If it's taking a walk around the neighborhood, whatever that is, you guys participate in those because it's going to make you feel better in the long run. Do not go beyond CDC guidelines. With the first bullet point, media distancing, I said that there's a lot of opinions and not a lot of research or based facts that we're seeing on social media. We need to stick with CDC. CDC, those guidelines are what we need to be going by. We don't need to go by what somebody's aunt's cousin, father's brother is saying based on opinion. Preserve some sense of normalcy. So, a lot of us right now are working at home, which is not normal in a COVID-free world, right? And we talked about this also in a different presentation, get up, keep your same routine, keep it as close to normal as possible. You'll benefit in so many different ways if we try to keep doing that. Be kind to yourself and others, guys. Everybody is super stressed out right now, which can manifest in a lot of different moods and ways, especially when we're in public places. So remember, be kind. You don't know what somebody is going through, what they're having to deal with at home. Maybe they just lost their job. So tempers might be very, very high right now. And then again, like I said, it can manifest in a lot of different ways. And seek professional help, guys. So if talking to best friend just isn't doing it anymore, and you feel like you need to talk to somebody else, don't be afraid to talk to a counselor, to a clinical social worker. That's what they're there for. And make that normal as well, just as normal as it would be for you guys to go to a doctor's appointment. Our mental health is just as important as our physical health. So if you feel like you need that next level, that extra step, seek professional help. Again, you know, I talked in the beginning that these two slides right here, we're going to kind of go hand in hand. So other healthy coping skills that you guys can consider. Know what to do if you're sick and are concerned about COVID. So you guys prepare. If you don't prepare, you prepare to fail. Okay? So you guys know what you're supposed to do, know where you're supposed to go if something happens. Don't look on Wikipedia for self-treatment. That's a no-no. Call your doctor, call your general practitioner, whomever it is, if you don't know where to go, and ask them. Know where and how to get treatment. And also know about other support services and resources. So like I said, seeking professional help, counseling, or therapy. Right now, therapy is very, very heavy in video. Telemedicine is what they call it, but it's essentially a video, and you talk to a therapist that way. It's HIPAA compliant, so you don't have to worry about any of those things. And you also don't have to worry about being exposed to COVID-19 because you're in the same room as a therapist right on top of them talking about your problems, right? So take care of your emotional health just like we take care of our physical health. I mentioned that before. This helps you think clearly, and it helps you react to the urgent needs to protect yourself and your family. We need those right now. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting, especially when you're getting a lot of opinions kind of wound up in there. Take care of your body, guys. Exercise, sleep as much as you can, eat as healthy as you can. All of these we hear over and over again 1,000,000 times, but that is because they are proven to be beneficial to our body, to our mental health, to our physical health, okay? Make time to unwind. Try to put in your schedule, just like you would a Zoom call, some activities that you actually enjoy. Is it painting? Is it reading? Whatever that is, make sure you are very, very intentional about scheduling and making that part of your day. Connect with others. Talk with people that you trust about how you're feeling, some of the concerns that you have. Have a support group. And then connect with your community or your churches. Obviously, we know that we've got a social distance right now. But again, technology is a wonderful thing. So consider connecting online. You can do this through social media, or you can do it by phone, iPad, tablet, however you have the capability to FaceTime, to Zoom, whatever it looks like. All right, so my last slide here. Well, I've got one more after this. You guys don't forget to take those post tests. I want you to stay safe and well, of course, and keep this training, this presentation handy, especially if you start noticing some of the things that I have discussed today. A lot of people can't grasp this concept of anxiety because you can't see it or touch it. But once you've experienced it, it almost gives you a clearer picture of what others in your family or your friend circle have experienced prior to. So be very aware, be very self-aware of your feelings, your mood, if you're sleeping a lot, whatever that is. And again, you can refer back to this. Always get in contact with your general practitioner if there are significant worries, or reach out to a counseling service. If you guys have questions or comments, please email me. My email address is here, bhuey@ucphuntsville.org. I will be happy to chat with you. If you've got a question, if you guys have a suggestion on a topic that you want to hear more about, I think the month of August is going to be heavily focused on depression and anxiety, because that's what we're seeing a lot of right now. So we want you guys to be as prepared as you can be. And then here are my references. So if you guys want just to keep the references instead of the actual presentation, this is where I got all of my information from. Please go and copy that link in the cycle of anxiety. It helps describe it a little bit better. I think it's only 5 minutes, like I said, so it shouldn't take much of your time. I know you guys, your time is valuable. And then, so you'll notice in my references, I've got a bullet point that says infographic on the last page of the toolkit. So this link right here will take you to a toolkit that was done. And it has a really cool infographic on coping with COVID-19 and the things that you can do. So if you're a visual person and you need like an illustration, that is perfect for you. But take a look. They did it for May, for the Mental Health Awareness Month. And it's very good. It's not too long, so there is a lot of valuable information in that as well. I hope you guys have a beautiful day. I hope that you will email me if you have any questions. I look forward to chatting with you. And you guys stay safe.